and I am the medical director at Regroup, which is a company that delivers the telepsychiatry services at the Josselyn Center, with whom we have a partnership that allows us to provide these services. Happy to be here.
Great. So we're going to take everybody through two of our key kind of innovative services. Dr. Mahmoud is going to talk about telepsychiatry here at Josselyn and just in general. And Mike is then going to talk about our walk-in services, which launched this year, and then we'll have some time at the end for questions. And if we don't get to your question today and you still want to reach out to us, certainly we can follow up with you. So Dr. Mahmoud is going to talk first about telepsychiatry and help us all understand how it fits into the bigger landscape of meeting some pretty critical needs.
Sure, thank you so much. I want to thank Karen for helping prepare this presentation. This presentation is partly based on kind of a more formal academic presentation that was given at the American Psychiatric Association annual meeting. And although it does kind of cover telepsychiatry in general, there are many, many aspects of what we talk about in this presentation that are very applicable to the Josselyn Center and the patient population that we serve. I will be sharing some slides with you, so please bear with me for just a second. Let me know if you're able to see the slides.
Yep. Perfect.
All right, so I will be speaking somewhat generally about closing healthcare gaps through telepsychiatry, really, which is a huge challenge across the United States and very applicable to our work at the Josselyn Center. So as many of you are aware, the mental health service gap is pretty wide across the United States, and it has been a challenge to meet the growing needs for mental health services across the country. It is estimated that at least 1 in 5 Americans experiences mental illness every year, and at least 1 in 25 experiences a serious mental illness with a major impact on their daily activities every year. And while these numbers seem large and concerning, the number or the percentage of people that actually are able to receive services for mental health conditions ranges between 40 and 45% depending on the source. And that's why we have that mental health service gap. Now, there are many barriers that have been identified as contributing to this gap. Some of the major, most concerning barriers are the shortage and uneven distribution of mental health professionals, including but not limited to psychiatrists. The time, cost, and burden of travel to receive services, mobility issues, be it from a kind of physical perspective, some patients living with chronic pain, or some patients who have mobility restrictions and are unable to either leave the house or travel long distances to get the service. And we also have mobility issues related to certain psychiatric conditions like PTSD or severe social anxiety that really limit someone's ability to travel long distances or leave their community because of that severe anxiety. Of course, we also face barriers related to patients being either uninsured or underinsured. And of course, there's the cost of care. When we talk about these barriers to access and kind of the percentage of people who don't get services, we're discussing numbers, but it's important to talk as well beyond numbers. So it's important to point out that the societal burden of mental illness, and particularly untreated mental illness, is significant and measurable. We have the cost of reduced productivity, workplace absenteeism, or even inability to attend classes or perform well in school. We have, of course, the direct costs. We have the human life lost costs, and there are costs associated with the comorbid medical disorders that tend to have worse outcomes when mental health conditions are not treated. So when we talk about increasing access to care, we're talking about improving healthcare equity, we're talking about overall societal well-being, but we're also talking about decreasing healthcare costs. Now, there are many ways in which healthcare facilities across the country have been trying to deal with these barriers and improving access to care for mental health and mental health conditions. One of these approaches to enhancing access to care has been leveraging technology to do so, and that is what telepsychiatry is about. So telepsychiatry is defined as the use of video conferencing as well as information and communications technologies to provide healthcare services remotely. I want to emphasize that the tele in telepsychiatry does not refer to telephone services. Actually, most of the services are delivered via video conferencing, but there are certain communications that can happen via HIPAA-compliant email or fax or phone. However, the primary means of delivering the service would be via video conferencing. Now, one little factoid that many people don't know is that telepsychiatry has been around since the 1950s, but the connection was slow and there was a lot of glitches. And so the scaling of telepsychiatry as a method for healthcare delivery has really expanded and it became a possibility over the past decade. The effectiveness of telepsychiatry has been demonstrated through multiple research projects and throughout the literature. This effectiveness has been demonstrated across various treatment modalities, different patient populations, different age groups, in different settings, be it inpatient, outpatient settings, ED, meaning emergency room settings, residential settings, as well as jails and patients' homes. There are a lot of studies that demonstrate that telepsychiatry is effective to treat a variety of conditions, including depression, anxiety, schizophrenia, PTSD, and substance use. It has also been shown that video conferencing does not compromise the therapeutic alliance between the patient and the provider, and that is definitely something that I notice in my work at the Josselyn Center, where I feel that I have a pretty good working relationship with my patients, and I feel that we've developed a strong working alliance together. In addition, studies show that there's a high degree of satisfaction among both patients and healthcare providers when doing telepsychiatry. Now, some of the ways in which telepsychiatry can help with overcoming some of the barriers that I mentioned earlier is that we are drawing from a national pool of healthcare providers in order to provide the service. So that helps us overcome the geographical distance. It also helps us continue to provide the service even if the provider has to travel somewhere. For example, I have been able to continue to provide services despite having to travel throughout Illinois. And so I continue to see my patients at the scheduled times that I have, and I'm able to continue to provide the service even when I'm outside of the Chicago area. Telepsychiatry really alleviates a significant component of that burden, the time, and the cost of travel. I know that if the Josselyn Center did not exist or was not able to provide psychiatric services, some patients would have to travel for hours and hours to find a psychiatrist, or just go without the service altogether. And finally, there's those mobility challenges that we talked about. There are many patients who, because of their physical restrictions on mobility, are not able to travel long distances, and therefore they're able to come to the Josselyn Center, but if the service weren't present, then they would have to travel several hours to get the service. And same applies to the psychological challenges to mobility that we touched on, because patients are comfortable coming to the Josselyn Center. They enjoy working with their therapists and case managers and being able to receive psychiatric services in a setting that they're comfortable with, that they're used to, really alleviates some of their worries about seeing a provider. The model of care that we use when providing telepsychiatry at the Josselyn Center is referred to as the integrated care model. The great thing about the integrated care model is that it mirrors in-person practice as much as possible. So despite the fact that I am not physically at the Josselyn Center, I'm able to access the electronic health record, so I'm able to read other providers' notes. They are able to read mine. We're able to coordinate care together. We have team meetings. We are able to discuss some more challenging and complex cases together in order for us to provide better care. We prescribe through the electronic health record, and this way everyone at the Josselyn Center will be on the same page about what is being prescribed and what is not being prescribed. It really fosters a sense of connection between the patient and the team, because despite the fact that the patient does not interact with me in person, they interact with their therapist, the therapist interacts with me, and I interact with the patient and the therapist as well. And so it's a very collaborative approach to care. This is just a visual that, of the overlap in the work that we do together. Historically speaking, one of the main challenges to expanding telepsychiatry has been reimbursement, although this has been moving in a positive direction. So at this time, Medicare will only reimburse sessions provided by telepsychiatry if the patient is at a physical facility that is in a county deemed to be outside of a metropolitan area or a rural health professional shortage area. Aside from that, Medicare will not reimburse telepsychiatry. However, this is going to be changing later this year, where Medicare will start reimbursing patients seen via telepsychiatry who have any kind of substance use diagnosis, be it dual diagnosis or just substance use diagnosis, which is a step in a positive direction. The other good news is Medicare reimburses at telepsychiatry at the same rate that they reimburse in-person care. When it comes to state by state, there's significant variation. A lot of variations, too many to keep track of, and it's changing all the time. However, all 50 states now, as of February of this year, all 50 states cover telepsychiatry one way or another through their public program, meaning their Medicaid program, and that does include DC as well. And we are seeing overall a trend towards expanding coverage for telepsychiatry and at the Medicare level, Medicaid level, and private insurers. So I'll wrap things up here, and I'm happy to take any questions later after my colleague, Mr. Schultz, presents. But I would just like to leave you with a message that telepsychiatry has really emerged as an effective and accepted method of healthcare delivery. It enhances access to mental health care. It decreases the care gap between rural, urban, and suburban areas and between different states. And it's able to mitigate some of the costs associated with healthcare, particularly the burden of and cost of travel for patients, as well as the cost of travel for healthcare professionals who live in remote areas. And that is my talk.
Thank you so much, Dr. Mahmoud. And